Hello, everyone, and welcome to this really important conversation entitled Targeting Health, Detention, Torture, and Attacks on Palestinian Healthcare Workers. My name is Kayum Ahmed. I'm based at Human Rights Watch, where I serve as the program lead for the Global Health Initiative. I'm very pleased to have been asked to facilitate this really important conversation, which I think will be led largely by my wonderful, brilliant, delightful colleague, Milena Ansari, who is the Israel and Palestine Assistant Researcher at Human Rights Watch. Milena is a trained Palestinian lawyer. She has a BA in law from Birzeit University and an LLM in international law and human rights from the Hebrew University of Jerusalem. Also joining us is Dr. Usaid Alsar. He is a general surgery trainee at Texas Tech University Health Sciences Center and global surgery researcher from Gaza, Palestine. Usaid is a medical doctor and has an MSc from Oxford. He is also a multi-award winning researcher. I should indicate at the outset that speaker remarks are based on their own scholarship and experience, and as such, they speak for themselves and not for Harvard University. And since we would like this discussion to be as interactive as possible, please feel free to submit your questions using the Q&A feature. And then we will try to get to as many of them as possible after Milena and Usaid have presented their opening remarks. And please be reminded that your questions are only submitted to speakers and the audience cannot see them. So with that, let's get started. And I usually start every meeting that I facilitate at Human Rights Watch with a poetic reflection. And so I'm going to share a link to a poem in the chat that I hope you'll be able to see. The poem is from Noor Hindi, a Palestinian American poet whose work, Dear God, Dear Bones, Dear Yellow, is absolutely incredible and powerful. And I want to share the poem, the particular poem that she writes about, entitled "Fuck Your Lecture on Craft, My People Are Dying." I'll post the poem in the chat so that folks can follow along as well in case they don't have access to the link. The poem goes as follows. Colonizers write about flowers. I tell you about children throwing rocks at Israeli tanks, seconds before becoming daisies. I want to be like those poets who care about the moon. Palestinians don't see the moon from jail cells and prisons. It's so beautiful, the moon. They're so beautiful, the flowers. I pick flowers for my dead father when I'm sad. He watches Al Jazeera all day. I wish Jessica would stop texting me, Happy Ramadan. I know I'm American because when I walk into a room, something dies. Metaphors about death are for poets who think ghosts care about sound. When I die, I promise to haunt you forever. One day, I'll write about the flowers like we own them. And this poem, I think, is a very powerful indication of the turmoil that I think many Palestinians feel in this particular moment, and especially over the past year since October 7th, thinking about and reflecting on the war crimes being perpetrated by Israel against Palestinians in Gaza and, of course, across the West Bank. And the anger demonstrated in this poem is anger that's also directed toward institutions that have been complicit in these war crimes being currently perpetrated, but also to our profession in the healthcare industry, in the healthcare space, and the silence that many Palestinians have noted of people working in the healthcare space who have not spoken out publicly about the attacks on healthcare workers. And so it is really important that we're having this conversation, and particularly going to be focusing on a really important report written largely by Milena Ansari, co-authored by a number of folks at Human Rights Watch. I was very fortunate to contribute to some of the report, which focuses on attacks on healthcare generally and the torture of Palestinians in Israeli prisons specifically. So I want to hand over to Milena to take us through the core components of the report, your particular findings, and perhaps issues that we should be reflecting on and thinking through. And then I will turn over to Usaid to ask for his reflections and thoughts. While Milena is speaking, I will also share a link to the report. So, Milena, over to you.
Thank you, Kayum, and thank you everyone for joining in your time and interest. And of course, thanks to PPHR for the invitation and the platform to speak about Human Rights Watch's report on the torture and unlawful detention of Palestinian healthcare workers from Gaza. Before I begin, if I may, I really want to emphasize that this is only one of hundreds of reports and documentation that Human Rights Watch has released since October 2023. And it's really important for this conversation about the detention of healthcare workers to be in the context of the mass atrocities that Israel is committing in the Gaza Strip. We have documented repeated unlawful attacks on healthcare facilities, including hospitals and ambulances in Gaza by the Israeli forces, unlawful attacks on residential buildings in Gaza, mass forced displacement, where 90% of the Gaza population, amounting to 1.9 million people, have been forced to be transferred from their areas of safety and shelters repeatedly over many times since October 2023. We've also documented the use of starvation as a method of war, where Israeli authorities are also unlawfully blocking the Gaza Strip, where it imposes a strict blockade and severe restrictions on humanitarian aid. Let me say, life-saving humanitarian aid to the Gaza Strip. So when talking about the detention of healthcare workers, it's really important to put in context the 14 months of Israeli mass atrocities in the Gaza Strip. But also, it's really important to keep in mind the root causes that have led us to another repeated hostilities in Israel and Palestine. And this includes Israel's apartheid and persecution against Palestinians when we're talking about systematic domination and systematic oppression against Palestinians in the occupied Palestinian territory, the Gaza Strip, the West Bank, and Jerusalem as well, East Jerusalem. To now focus more on the report, and apologies, I fear that most of the audience would come in with a health background or medical background, and my background is more law. So I will mainly try to focus on what we're seeing as violations of human rights, and how these violations create crimes that should be prosecuted, and Israeli authorities should be held accountable for these crimes. To begin with, the report interviews 8 healthcare workers from Gaza. This includes doctors, nurses, paramedics, surgeons as well. These interviews, and it's really unfortunate that Mu'adh Sir from Healthcare Workers Watch Palestine isn't here. We collaborated with Healthcare Workers Watch to work and interview healthcare workers who were released and were in Gaza. So the testimonies we got, although they were from 8 healthcare workers, these accounts were consistent with independent reports, including from the United Nations Office of the High Commissioner for Human Rights, from UNRWA as well, and from UNICEF. It also is consistent with what Palestinian and Israeli human rights organizations have been systematically documenting for the past 14 months, relating to the detention of Palestinians in general, whether the West Bank, East Jerusalem, East Jerusalem or Gaza. So the healthcare workers we interviewed, most of them, the majority, were detained by Israeli forces in Gaza at their workplace. So following Israeli sieges of hospitals or during evacuation of hospitals where the Israeli military was ordering patients, healthcare workers, and even the displaced people in hospitals to evacuate within hours after they siege the hospital. And these evacuation orders or sieges of the hospitals, there was clear coordination between the Israeli military and the humanitarian organizations on the ground in order to make sure there's no violations. But as we've seen, it was an opportunity, I would say, for Israeli forces to mass and arbitrarily detain Palestinian men at that time. So important to note that none of the healthcare workers we interviewed were informed of the reasons of their detention or charged of any offense. When the healthcare workers reported about their interrogation and what the questions were proposed to them during interrogation, it mainly was very general questions or accusations by Israeli interrogators that these healthcare workers are affiliated with Hamas. And while the healthcare workers all denied these accusations, Israeli interrogators did not care at all, but continued to detain them without charge and without trial. Most of all the healthcare workers were completely isolated from the outside world. And this is what we see reflected in Palestinian detainees in general, where everyone in Israeli detention is completely isolated. There's no communication with family members to either let them know they're okay or to also, because these healthcare workers are from Gaza, most of them were worried about their family, their children, their immediate family, if they were alive or dead. So this was also an additional psychological element to the situation. But when we talk about what happened, what did Human Rights Watch document? Basically, we documented humiliation, ill treatment, and torture all throughout the process of the detention of healthcare workers. It started from being detained in Gaza to being illegally transferred and forcibly transferred to detention centers in Israel proper. So this alone is considered a war crime because an occupying power, which is Israel in this case, occupying Gaza and the OPT in general, cannot, under international humanitarian law, transfer Palestinians or the occupied people to detention facilities inside Israel outside of their territory. So everyone who was detained from Gaza and taken to detention facilities in Israel, this was illegal and war crimes under the Geneva Conventions. And what I mean by throughout the arrest process and detention process is through the transfer, most of the Gaza detainees and the healthcare workers we spoke to were put on open vans, open trucks, and blindfolded immediately, handcuffed by their hands and feet, stripped to their clothes. Some were given white overalls to wear, very thin white overalls, but the majority were transferred, stripped to their underwears. So it started in Gaza, and throughout the whole experience, the healthcare workers reported ill treatment, humiliation, and torture. So when they reached detention facilities, many of them, 6 of them, were detained in military bases that are not designed for detention purposes, where the detained healthcare workers were put in what they described to us as big cages, as big warehouses without a proper ceiling, where in each warehouse or each cage, hundreds of detainees from Gaza were detained alongside the healthcare workers. And of course, all during all this time, from the transfer up until detention, and even inside detention, the healthcare workers and the detainees were constantly blindfolded and cuffed by their hands and feet. And once they've reached the detention, whether it was in a military base or an Israeli prison service detention facility, they were abused throughout their detention. And when we talk about abuse, it's the prolonged cuffing, it's medical neglect, it's physical violence with constant beatings by the butts of the Israeli soldiers' rifles or by their boots, who are steel-toed boots. And the healthcare workers reported that the physical assault or the beatings were always targeting sensitive areas, or targeting the head, targeting the neck, the chest area, but also private areas between the legs, at their bottom as well. So this, in addition to the physical violence, there was the element of threats of sexual violence as well. At least 3 healthcare workers reported that they were threatened with rape or sexual assault. I'd mention one of the cases we reported. The Israeli soldiers detained the healthcare worker while he was evacuating North Gaza to the south following Israeli military evacuation orders, or what we should be calling displacement orders. So he was with his mother, so he was with his family. And when he was detained and taken on a side, Israeli soldiers threatened to bring in his mother and completely strip her from her clothes in front of everyone in the middle of the field interrogation that the Israeli forces created inside Gaza. And throughout the physical assault that I mentioned, there was a continuous psychological assault, not with regards to threats of sexual violence, but also threats of death, threats of targeting their families inside Gaza, targeting their children, constant cursing, cursing God, cursing Islam, and cursing in general Palestinian identity throughout this process. If I want to break down a few things about, for example, the living conditions or the condition inside detention. And again, I'll just emphasize this is the same treatment for all Palestinian detainees. And we're talking about more than 10,000 Palestinian detainees currently inside Israeli detention. So the healthcare workers reported inadequate food and water. I'm using inadequate, but the proper terminology would be absolute deprivation of food and water. The detainees, the healthcare workers would go for days without having food, or for days without water. And even when they were given, for example, 3 meals a day, these meals always included a small piece of bread, like a pita bread, that would be distributed amongst 10 or 20 detainees, or one vegetable for 10 detainees or more. There was no sugar or proper salt in these meals. So the nutrition value of the food did not exist for them. And this was apparent in many of the before and after images of the healthcare workers when they were detained and after they were released. Most of the healthcare workers we interviewed lost probably more than 10 kilograms of their weight. I'm sorry, I can't give you the equivalence to the US measurement to that, but you can Google it maybe. But at least 10 kilograms of their weight it was lost. And this indicates as well to the type of food and treatment they were given. And I would really highlight medical neglect. We were fortunate to interview healthcare workers. So when we asked about medical neglect inside detention, we trust the expertise of the healthcare workers because themselves know what is the proper medical treatment that should be given to detainees. So the healthcare workers either themselves experienced medical neglect. One healthcare worker who had injury from an Israeli airstrike before his detention near near the hospital he was working in, he had his hand, he had an injury on his hand, and he repeatedly asked during detention for medical treatment, at least changing the gaze on their hands or giving them any medication to lessen the pain. But constantly the answer was no. We will not. And sometimes we've had healthcare workers who reported Israeli soldiers who were guarding them, telling them, we'd rather you die than we give you medical treatment. And of course, this varies from one detainee to another, but the overall pattern was there was no medical treatment being properly provided to Palestinian detainees. And here I would also cite Physicians for Human Rights Israel, who documented severe, severe interference, political interference by Israeli authorities to the ability of what the healthcare workers can provide to Palestinian detainees. Many detainees were given surgery or performed treatment without anesthesia. With the prolonged cuffing by the hands and feet, there were reports in Israeli media about amputation of Palestinian detainees' limbs due to the prolonged cuffing that affected the blood flow and affected the survival of the limbs. So we're talking about severe and harrowing testimonies with regards to medical neglect. And needless to say, this has led to deaths inside Israeli custody. The Office of the High Commissioner has reported at least 53 Palestinian detainees who died in Israeli custody. And when Physicians for Human Rights Israel attended autopsies for 4 Palestinians who were pronounced dead inside Israeli custody, they found in 2 cases clear medical neglect, and in other cases they found blunt force trauma, like torture, abuse for the detainees. And these are not only the detainees in general, but it includes healthcare workers like the renowned Palestinian surgeon, Dr. Adnan al-Bursh, who was pronounced dead in April this year by the Israeli authorities. And recent autopsies or recent investigations have led to or prove that he was subjected to torture and ill treatment. And this is only one case, Dr. Adnan al-Bursh. There's also Dr. Iyad al-Rantisi. And these are unfortunately the cases that we are aware of, the cases that we know of. Israeli authorities have completely banned the ICRC, the International Committee for the Red Cross, from monitoring detention facilities and visiting the detainees to make sure that the living conditions and treatment meet what is required under international law and international humanitarian law. So it's like a black hole. We don't know what's happening. What we're seeing or what we know is up until the person is released and they're able to report back to us. But also Palestinian human rights organizations like Ad-Damir has the capacity to visit a few detainees, and from there they can also see a similar pattern of abuse and ill treatment. I've mentioned sexual violence, and it's really important to emphasize that there's zero accountability when we talk about these violations. Recently, a few months ago, the Israeli military investigative body detained 10 Israeli soldiers for raping a Palestinian detainees. A few days later, the detained Israeli soldiers were released on house arrest, and up until now, we haven't known what exactly the investigation has led, and we're talking about a rape of a Palestinian detainee to a point where he was taken to a hospital unable to move. And we've heard Israeli officials come out with statements where they say, don't touch our soldiers. These are holy soldiers. They are our heroes, as if accountability doesn't apply on Israeli soldiers when they commit grave abuses of international law and human rights law. And with this, I'll emphasize that it's not only since this year or for the report of the detention of healthcare workers. Human Rights Watch has documented decades of impunity of Israeli torture inside interrogation against Palestinian detainees. We've documented decades of impunity and whitewashing of investigations against Israeli soldiers or prison guards that commit abuses against Palestinian detainees. Um, I'll maybe focus now a bit on two cases, if that's okay. One case is for Dr. Khaled Hamoudeh. He's a surgeon who works at the Indonesian hospital and was arrested. He was arrested from a Nasser hospital. I'm just going to share my screen to share an initial image that I will discuss more. So just sharing my screen now. And you're seeing everyone. Sorry. I hope the image is clear. Basically, in this image that Human Rights Watch was able to verify and investigate further, we were able to geolocate where exactly this image was taken. And with the interview that we got from Dr. Khaled Hamoudeh, who's this person in the image, he's the second one from the left, wearing Crocs, gray pants, and no shirt. When we were interviewing Dr. Khaled Hamoudeh, we asked him about this photo, and what he explained to us was completely harrowing. Let me just stop sharing my screen. What he shared is that when the Israeli forces started sieging basically in Nasser Hospital, Kamal Adwan Hospital in northern Gaza. They asked everyone in the hospital to evacuate. They took healthcare workers, so the doctors, the nurses, the surgeons on a side, and the people who were displaced, who were sheltering in the hospital on a different side. Mainly, they allowed women and children under the age of 12 to continue evacuating south, but men between the ages of 12 and above were all either detained for a short period of time and later released, or detained and taken to Israel for in detention facilities. But why I wanted to show the image, because this image was taken approximately half a kilometer northeast of Kamal Adwan Hospital, where Dr. Khaled Hamoudeh was detained, and he reported that 50 other healthcare workers were sitting together separately from the internally displaced who were sheltering in the hospital. And they were taken 5 by 5, stripped to their underwear, interrogated in the field, and then they had their picture taken, their fingerprints taken. And from that moment on, they absolutely had no communication or no understanding to what will happen to them, or when will they ever see their family again or be back in Gaza. So if the image also shows that most of the detainees, and in the background there are dozens of other detainees, most of them are blindfolded and cuffed by their hands. And this just shows how the intention of detention and arrest is a prolonged is a is a is a prolonged thought. There's a whole pit of sand that the Israeli forces created, where the area had residential buildings, but in the picture you only see a pit of sand. But the other case that I'd like to go more in depth is the case of Walid Khalili, a 36 paramedic with the Palestinian Medical Relief Society, who has 3 children and a wife, 3 young children. Walid Khalili was answering a call for help, an emergency call that was received to the PMRS, the Palestinian Medical Relief Society. And when he was in his ambulance heading to take the injured Palestinians to a hospital, he was detained by Israeli forces, who immediately strip searched him and zip tied his hands behind his back and blindfolded him and took him to another location. I say another location because most of the detainees were unable, the healthcare workers were unable to tell us where they were or what they saw, because again, they were blindfolded most of the time. So the soldiers started their abuse and assault against Walid Khalili from that moment inside Gaza, where one soldier stepped in on Khalili's face and pushed it in the sand, while the other one threw gasoline on Walid Khalili and threatened to set him on fire. Moving on to the transfer period from Gaza to detention facilities inside Israel, soldiers put Walid Khalili on the ground and in a way drove their vehicles quickly towards Walid Khalili and all of a sudden stopped threatening as if to run him over. So, and this continued with cursing and threats and humiliation all along. But what is the most harrowing, and I hate to say this because all the testimonies we've gotten were harrowing. And, you know, I've worked with a Palestinian human rights organization on Palestinian prisoners and detainees for 3 years before Human Rights Watch. And I've never felt so emotionally, you know, devastated after taking these testimonies, because they're on a whole new level of torture and ill treatment that the Israeli forces is subjecting Palestinian detainees with. So Walid Khalili, when he was moved to Israel or forcibly transferred to Israel, he was first taken to this big warehouse that later on we understood was Sdei Timan, where nowadays we're hearing about Sdei Timan a lot more about, and the abuses that are coming out of Sdei Timan. So in Sdei Timan, he explained to us that when the Israeli soldiers removed the blindfold from his eyes just for a few minutes, when he opened his eyes, he saw a whole warehouse with handcuffs suspended from the ceilings and dozens of Palestinian detainees cuffed by their hands, suspended by the ceiling. And this is when Walid Khalili experienced this himself. He was stripped by his clothes and he was forced to wear a white overhaul that, according to Walid, said had metal wires around it. And he was forced to wear a headband that also had metal wires around the head. And he was later suspended from the ceiling, where his feet were not touching the ground, but his hands were raised up. And at that moment, Walid reported that he was electrocuted and shocked by electricity every few seconds, while Israeli soldiers were interrogating him, constantly telling him, confess you're a Hamas affiliate, confess you're a Hamas affiliate, with the electrocution, with the stress position. This all amounts to torture and ill treatment, physical and psychological as well. But it didn't stop here, unfortunately. After spending a few weeks in Sdei Timan, Walid Khalili was transferred to a prison facility, an Israeli prison service prison facility, and that was Naqab, the Negev prison facility. And there he witnessed, or he reported seeing a Palestinian detainee who was bleeding from his anus, from his bottom. And when Walid Khalili asked the detainee, what happened? What's wrong with you? The man told Khalili that before he was placed in detention in Naqab prison, 3 soldiers took turns raping him with an M16 assault rifle. And Walid Khalili explained to us that the detainee looked severely broken from inside. His mental health was awful, his physical health was awful, and he was talking to himself. So Walid Khalili testifying to this and having experienced all that, I wanted to really highlight his case so prominently, because it basically collected all the abuses that we've heard from different detainees and the different healthcare workers who were released. I'm not sure. I usually speak too much and way over the time limit, so I assume I should stop,
Wow.
right?
We can pause there, Milena, and certainly want to offer you more opportunity to elaborate on some of these really awful, horrific cases that you sat in and listened on and documented. but also want to offer Usaid an opportunity to join this conversation, but really wanted to express my profound thanks and appreciation for sharing, I think, not only the broader context and the history of war crimes and attacks on healthcare workers that you documented, but also zooming into specific cases and amplifying these examples, I think have been particularly important. Usaid, perhaps turn to you. You know, we read these stories, these cases developed by people like Milena at Human Rights Watch, Amnesty, and other organizations. And at the same time, there's this continued silence from the medical community. I want to quote something that you wrote in Al Jazeera earlier this year. You say, and I quote, the medical community at large has been utterly silent about or even complicit in the ongoing attacks on Palestinian healthcare. Several hospitals and academic institutes issued one-sided statements supporting the Israeli regime and censored their students and staff who spoke up against the genocide being committed in Gaza and in the West Bank. And I was curious, whether you could reflect on this as someone who is a healthcare worker who works in this space, and yet you see all of these cases and stories emerging. Why do you believe that the medical community has been so silent? And I should add, while we are on a platform being hosted by Harvard, Harvard is certainly part and parcel of those communities that have been completely silent. So perhaps you could share, Usaid, with us some thoughts and reflections on that issue. And I also know that you've engaged in certain interventions like telemedicine to assist people in Gaza and healthcare workers in particular who've been dealing with the emotional and physical effects of the ongoing war crimes being perpetrated against them. Perhaps you could also reflect and share some of your thoughts on that.
Yeah, first of all, thank you so much for having me, and it's a great honor to join this panelist. I mean, I don't have any great explanation as to why there is still a lot of silence other than complicity. I mean, at this point, it's more than a year of a genocide, and we're talking about at least 600 healthcare workers who've been killed and thousands who've been injured and at least 300 abducted with zero charges. Still a lot of medical communities have not even released a statement, or even if they release a statement, the statement would, I'll quote an example, one of the American Society of X, they basically just said, we feel sorry about what's going on in the Middle East. They didn't even mention the word Palestine. They didn't even mention any. It was just put a Middle East kind of term, which is a very kind of racist, very ignorant term to use for a specific region that a lot of people should know what's going on right now. Or they issued statement, one-sided statement that just didn't really address what's going on. While if we see what's going on in Russia and Ukraine, a lot of societies send, whether it's a surgical team, medical teams, to go there and help out in what's going on. We did a kind of like a small study that has not been published, but just kind of an exercise that we looked at one of the American societies. And basically, we looked at how many, the number of kind of mentions for Gaza, West Bank, or Palestine in general on their website, and compared that with Russia, Ukraine. That society, published at least 170 kind of articles to kind of summarize their achievements that they've done for Russia and Ukraine, and only four that mention either Gaza, West Bank, or Palestine. And those were very generic, very kind of like unrelated to what's going on. So we can see the complicity of those big societies that unfortunately they take our money for their membership and they just don't really use it for what the members ask for. And so, I mean, I think at this point, anybody who has not spoken up is complicit. I don't have any other views on that. I don't see anybody who's just ignorant, or let me put it this way, or anybody who's just innocent and they just don't know what's going on. And then, I mean, it's enough. It's like a lot of people have been killed. A lot of people have just lost everything. And honestly, quite frankly, a lot of Palestinians, including me, they just don't care at this point about like whether they do or not, because really they're just we're just sick of it, and we don't care whether they do or not. Obviously, we try to do our part by like making them accountable. But like whether they do or not, we're just sick and tired of that at this point. Now moving to our work, and I don't know if you want me to present my presentation or delay it for later. But
Please go
you
ahead.
know,
Please go ahead and present that now.
okay, let me just put my slides. Can you see my slides okay?
Yes, we can. Thank you.
Okay, perfect. So, this is just work that we as a group of researchers from across the globe, Palestinians and non-Palestinians, have done since January of this year. And so, yes, we're talking about healthcare workers and the impact of them, but we kind of like looking at it from a telemedicine initiative that we've done. And then through that, we're documenting not just how we helped the and supporting the trauma care in Gaza, but also documenting attacks on healthcare workers. My disclosure, I'm not an expert in telemedicine. This is not a webinar about telemedicine, but we're just presenting an exercise or an initiative that we participated in, or we kind of co-founded, to give an example on something that we created and try to help our people there. I studied medical school in Gaza. I'm very proud of that. I always mention that. I don't shy away at all. My training in Gaza gave me a lot of like strength, and at the same time, it made me kind of really feel sad about what's going on, especially the killing and injuring like my mentors, my mentees, my medical students that I taught in medical schools, but also my colleagues who work in those hospitals. I personally work in pretty much all the major hospitals from north to south during my training in Gaza. And so this is when we kind of mention like this doctor, for example, Adnan al-Bursh, not only he was my mentor, but also he treated my mom and my dad for free. So it's not like we're talking about some random people. Those are my own people, my friends, mentors, mentees. So this is a kind of a first-hand experience. Yes, I was not in Gaza, which I was hoping if I can go back, but I was not able to. But I witnessed at least three major, I don't call it war, military aggressions or genocides, minor, less aggressive than this one in Gaza. So I can speak on that as well. So this is just a kind of similar to the healthcare worker, Human Rights Watch, and but kind of citing some updated numbers from the OCHA, which you can go back and refer to, and Healthcare Worker for Palestine. There have been at least 43,000 Palestinians killed, and this number does not include people who are missing. And just to give a note, OCHA also has kind of like stopped updating their numbers for the last few months. So I'm pretty sure those numbers are underestimating the real number. More than 100,000 Palestinians have been injured. This is just in Gaza. And more than 50% of them children and women. There is some other reports that mention at least 70, but the number have dropped to 50 without providing further explanation as to why. But even like with that, still it's more than half are children and women. So that's a significant number. Number of attacks on healthcare facilities, there have been more than 1,000 attacks on healthcare facilities, whether they're like hospitals, primary care facilities, etc. All the hospitals, including Nasser Hospital, which is the study site for this project, and primary healthcare facilities in Gaza have been attacked. So literally every single hospital in Gaza has been attacked, partially or fully damaged. Some of them were able to recover. For example, like a Shifa hospital, we saw it was burned, but the Palestinians were able to recover some parts of it. The latest number from OCHA is at 19 out of 36 hospitals are non-functional. The number that Healthcare Worker Watch reported is at least 595 healthcare workers have been killed. There have been other numbers, around thousands, but those are not fully verified, at least per Healthcare Worker Watch. So we can for sure say around 600 healthcare workers have been killed. And 130 ambulances have been destroyed. So it's direct attacks, not just on doctors, nurses, but also paramedics. So this is just a bubble chart, if you want to call it that way, from Healthcare Worker Watch, and represents the impact on healthcare workers, specifically killing healthcare workers. You can see the majority were nurses. 185 nurses have been killed, 91 physicians, and then the rest of them were between paramedics, medical and dental students, and other facilities. So it's literally across the spectrum. And so we're talking about a destruction of an entire healthcare system. And those are not numbers. Those are like stories of success, the most hardworking people I've ever worked with, I've ever met, I've ever like learned from. Those are people who taught me what medicine is. Those are people who, for me, represent the true meaning of medicine, where people, despite the destruction of their houses, their belongings, they remained at the hospital. They came back after the hospital was destroyed. They revived the hospital, literally resuscitated the hospital, brought it back. Their families, unfortunately, a lot of stories, and this is from friends who witnessed that. A lot of people, especially doctors, when they leave, they either leave their house or come back to their houses were targeted. So we're not talking about like collateral damage. This is intentional targeting of esteemed colleagues and healthcare workers who were basically just providing care. They're just doing their job, and then they were bombed. And I'll give you an example. Dr. Midhat Saidam was one of my mentors, who was one of the very few burn and plastic surgeons at Shifa Hospital, who basically, when he returned back from Shifa Hospital after spending many days at the hospital, he and around 30 of his families were killed because the Israeli military bombed their house. So this is intentional targeting of healthcare workers. So being a healthcare worker in Palestine, especially in Gaza, that's per the Israeli military, this is basically their charges. Because you're being a healthcare worker, you're doing your job, you're going to be targeted. So to focus more on this project, this is Nasser Hospital. And so you can see since day one has been very, very crowded. A lot of casualties have arrived to the ER. The intensity of attacks on healthcare facilities, especially in the south, Nasser Hospital is actually one of the largest hospitals in the city of Khan Yunis. It's actually the largest, excuse me. It was basically the main hospital providing trauma care for people, because a lot of people fled from north to south. It was invaded twice, and this is a picture of the wall of the hospital. You can see this is the same on the left side. This is the same ER, but just from outside, showing the destruction of the wall of the hospital. So the hospital was invaded twice, one in January and one in February. And the first time it was invaded, the patients and healthcare workers were either were allowed to evacuate or abducted from inside the hospital. One of them actually was one of the co-founders of this initiative, Dr. Khalid Assir, who happened to be my cousin. He was actually abducted from the hospital, was detained for 12 hours in a nearby facility, and he was basically allowed to take care of the injured people in the neighboring. It was not in the hospital itself, it was just next to the hospital. And then he was released after that. That was in January. And then in February, the hospital was attacked again. And then in March, actually, it was also attacked. And then in March, when Khalid was abducted. But between January and March, we've been working on this telemedicine initiative, and we basically supported Khalid and his colleagues to provide trauma care to the patients. And also, he, at that time, we documented how Khalid disappeared, and then we found out that he was abducted as well. So let's dive into the project. So if you for me, I consider myself somebody who's passionate about global health, especially global surgery. That's near and dear to my heart. And I've been involved in that since the establishment of the Lancet Commission on Global Surgery in 2015. And I've been doing a lot of projects, whether it's advocacy projects, research projects, teaching, etc. But the big thing that with time, that I'm a believer in is evidence-based advocacy. And this is kind of inspired by one of my friends and mentors, Dr. Matt Gilbert, who his term was more of like evidence-based solidarity. But because I'm Palestinian, I thought about using evidence-based advocacy, where I advocate for my own people, but using evidence. So with that, I mean research. So we studied our experience in this telemedicine group, where basically the group was a telemedicine WhatsApp group. It wasn't something fancy, but because this is the most popular social media app that people use in Gaza, we started that in January by Dr. Khalid Asser, who, as I mentioned, who's a general surgeon and was the only remaining general surgeon at that hospital, because the rest of them, they either killed, abducted, or displaced to other areas, including outside Gaza. But Khalid, because his family lives there, he also he's that kind of person who's absolutely, I'm not going to leave the hospital. I'm going to stay. I'm going to take care of my patients. So he asked for help because, he would, have patients with like pediatric patients, less than 18, or patients with specific traumatic injuries that he's not used to deal with. For example, cardiothoracic, or injury to the heart or the chest. For the most part in Gaza, a cardiac surgeon, a heart surgeon, is the one who's supposed to deal with that. But Khalid had to deal with those cases and treat them, despite not having specific training in that or fellowship in that, because he was the main one, who was the only general surgeon dealing with those cases. So we sent invites to like trauma surgeons and other, and even non-surgeons, intensivists, formally, and then also kind of word of mouth, spreading that. Even Twitter, we shared that invite to have people come and join us. So this is just a screenshot of it. We thought about calling it, we called it for what it is, what we think it's a genocide. And that, that term everybody agreed on, despite having a lot of kind of some people who are not part of the kind of admin group, they wanted to remove the word genocide. But we truly believe this is a genocide. That's why we call it Gaza Genocide Trauma Cases. So we have specialties. We started with trauma, but also had OBGYN, orthopedics, vascular, ophthalmology, etc. So ended up having 19 groups in pretty much all the specialties, and specific groups for like free chatting, pre-texting, and like kind of medical missions. And, somebody is going to this hospital, let's meet up and let's kind of chat about your experience, stuff like that. So it was kind of also a platform for people who are visiting Gaza to connect. And I've heard a lot of stories about people who use that to kind of meet and connect and network. So because we were doing research, we want to meet all the ethical requirements. We took verbal consent from all the patients who participated and presented their cases here. We obtained expedited ethical approval, and I'm happy to talk on the side privately for people how to get it, but it was a very painful process. And just to mention, the person who was in charge of that ethical approval, Dr. Yahya Abed, was in the north of Gaza, was under siege at that time. And, because the journal insisted to get this ethical approval, despite telling them he's in danger and we can't do it, he was kind enough to help us with the expedite the ethical approval. We felt really bad for asking him for that question, but we had to do it because otherwise our work would not be published and shared with the community. So we selected certain cases based on their complexity and kind of what we call interesting in non kind of war situation. But those cases were very sad, and people from like experts from the US, Europe, and other countries helped in those cases. So we did some simple statistical analysis, nothing fancy, just to kind of summarize the results. So we had this analysis was done back in May. So we had 1,167 healthcare workers from different specialties. We discussed more than 50 complex trauma cases, the mean response time was 2 minutes by the people who were helping in those cases, which is quite remarkable. So our sample, what we ended up publishing and presenting was 12 patients. 6-7% were males, 33% of them were kids, less than 18. The age ranged from 3 to 70, with a median age of 25. The majority, not surprising to us, were penetrating injury at 92%. The majority were either blast or gunshot injuries. The majority had abdominal injuries, 50% abdominal or pelvic injuries. A third were head and neck, 25% chest, and 8% extremity. And of note, a lot of those patients were polytrauma, as in they have more than one location for their injuries. Pretty much everybody lost to follow-up. When we say lost to follow-up in the medical world, that means that they do not have an outpatient appointment to check on them, make sure their wounds are feeling okay, their drains need to come out, and all of that. And so we said 92% because the remaining patient actually died in the hospital. So those who survived beyond their hospital stay, they were lost to follow-up. Of note, of the people that we studied, 2 of them were abducted. One of them was actually a healthcare worker, and that's our focus today. And that will be the discussion over the next few slides. So when we say those patients were taken from the hospital, they were patients, they were getting medical treatment, and they were taken from the hospital. So, of course, with time we get used to it, and oh yeah, it's happening. But just think about it for a moment. If you are in the US or in the UK or in other countries, and you have a patient, you are a doctor, you are a nurse, you are a physiotherapist, and your patient, you're about to round on them, is not there. So you're wondering, did the patient leave AMA? Did the patient just went to smoke outside or do something? But in Gaza, the possibility is that, yes, your patient was abducted. And so just think about it for a moment. I want everybody to think about it who's new to the Palestinian cause and who's new to this. Just think about it for a second. Your patient, your own patient that you're taking care of, is abducted from a hospital. Can you imagine how crazy that is? So just to kind of skip and go to this patient. And so I have a video was recorded by Dr. Khalid Al-Ser for this patient, who's a 35-year-old man who was an OR nurse. So for those who are not in the surgical field, when you are in the operating room, you have a surgeon, you have a scrub tech who is basically helping the surgeon to operate. You have residents, you have trainees there, you have medical students. You also have what we call circulators, or basically nurses who help to bring stuff and kind of chart and all of that. So that one of them was who was this nurse. So he was actively working in the operating room when he was shot. And so this is just a video, and for those who do want to watch, you can skip it. There is a QR code as well. You can go and check it out. But I'm gonna play it because this is important to watch for people who want to know more about what's going on and kind of have a visual understanding of what happened to this nurse. And I don't know if the audio is gonna work, but I'm gonna try it. Can you guys hear the audio?
Unfortunately, there's no audio. I think when you share your screen, you might have to enable audio so we can hear you say.
Okay, let me try that and see if it's gonna work.
In the meantime, while you're doing so, I'm noticing the excellent question.
How about now? Can you hear me? Can you hear it?
No, nothing yet. And while you're sorry, unfortunately, nothing yet to say. We can't hear. You might have to stop sharing and then try to reshare. And when you reshare, you can click on the enable audio function.
Okay.
While Claire is doing that, I just want to encourage folks to please continue posting questions in the chat. I've noted the questions that are being asked, including questions around solidarity, the AMA's position on this issue, healthcare worker and their families are being targeted in Gaza. So please continue these questions, and we'll certainly find the space and time to do so after Usaid has completed his presentation.
Okay, I'm gonna try that. If it doesn't work, it's fine. We have a QR code people can scan. So let me just play it. So this is the operating room, and so the video is pointing to where the nurse was. So you can see what appeared to be like a bullet. It's like on top of the window. So per eyewitnesses, because they saw like a quadcopter drone next to the window, they believe it's either from that or from a sniper. Because they were taking like the tall buildings next to the hospital, so they believe this either one of these that resulted in the injury of this patient.
Can you guys still hear me okay?
We can hear you clearly, yes.
Perfect. Okay. So that was the example of this patient. So this case was presented after the patient was resuscitated by Khaled himself, the only surgeon there. And let me move to this one. So he was stable enough to have a CAT scan, which basically the CAT scan was taken after he was resuscitated, and a chest tube or a drain was placed in the right side of his chest. And so the chest tube was placed on the right side because he had what we call pneumothorax and hemothorax, which means air extra like outside the lung and blood as well because of the gunshot. And so at that time, he had the CAT scan, and you would expect for people in the surgical field or in the, do ER or in intensive care, you would expect the chest tube would control this air, which is a black part and kind of the little bit of blood in here and the air outside, but it was not. So it was not working. So this video was presented, and basically Khaled was asking for help. What do you guys think we should do? So the immediate question was like, was the chest tube, which is drain, was it under suction, where you can suction the air out so that you relieve the pressure on the lung and let the lung expand it? So Khaled knows how to manage it, and he said, unfortunately, we don't have wall suction; it's not working. And so the medical community in the group suggested that, and actually one of them was a trauma surgeon from South Africa, and the other one was an ER doctor from in Canada. They basically suggested take like a piece of glove and cut it, and take this part and put it at the kind of end of the chest tube so that it serves as a one-way valve. The fancy valve is called Heimlich valve, which we do have here in the US and many countries, but that valve was not available in Gaza. So they tried this and it worked, and the patient recovered. However, we're not presenting this because this is like an innovation and kind of like, we're proud of this and all of that. But we're presenting this because this patient was one of the two patients who were abducted. So a week after this patient sustained his injury, the hospital was invaded and the patient was abducted. And so the patient was finally released after several days. And then after he was released, we chatted with the patient and asked him what happened. And he said he had this chest tube and the canister connected to his chest. He was taken there. He was beaten to the chest area where you have the chest tube and to the head. The chest tube was dislodged, so it was removed out of sight of his body. And if that happens, usually that means that you're no longer controlling the air leak that is going on in your chest, and you have a high chance of dying. Fortunately, this patient did not sustain major like kind of complication from that. So he remained hemodynamically stable. But the thing is, he did not receive medical treatment. He did have, because of the trajectory of the gunshot, it was coming to the right side of the chest near the collarbone and going to near the shoulder. From the clinical symptoms that he does have, it appears that he has a brachial plexus injury that has not been treated. And so he still have those kind of symptoms, in addition to, of course, the psychological trauma that he's sustaining, to the point he's refusing to interview with anybody, and it looks like he has some psychological damage that happened, and that's not surprising. I mean, you're working in a hospital, you get shot and you get abducted, and you didn't get any medical treatment. You're still in Gaza suffering, and you don't have the luxury of having a follow-up appointment to fix what happened and what caused that injury. So this is just one example, and I'm sure there's so many examples that people looked at and into it. But I wanted to present this case because it's an example of where people like healthcare workers sustain injuries while they're at work, while they're on duty, and they become patients, and then those patients they don't get the treatment they deserve, and of course get like kind of tortured as well. So obviously, for any initiative that we do, there is limitations. I'm not gonna go much into it, but we didn't have a lot of like cases to discuss, and partly because after Khalid was abducted, who's the co-founder of this initiative, the initiative went radio silent, and we wrote about that for FYI in the Guardian. You can refer to that, where we talked about how this impacted trauma care in Gaza as well. We published the results of our study in the Lancet for people who want to look at it and look at other patients as well. Everything is documented. Everything is, this is a very rigorous peer review that we went through for over a 7-month period. And so people can check it, and you can email me. My email is in the paper if you have any questions or concerns. So just my last slides. This is the primary author, Dr. Khalid Asteri. You see, this is he's standing in front of the ER at Nasser Hospital. This was, I believe, it was in January, before the hospital was invaded, and this is after he was released. So after he was abducted for 6 months under what they call administrative detention, where essentially he had no charges whatsoever. He was released, and this is a picture that he took. You can see how much weight he lost. And I asked him specifically how much weight he lost. He said that he lost 30 kilo, which is like 60 pounds, which is a lot. And so he basically, this is in front of his house, his own house in Khan Yunis city. And that was after he was released. He is now back to work. And so he's now back operating. And unfortunately, he was not able to join us. Otherwise, I would love to have him and share his experience. So that's pretty much it from my end. I'm happy to take any questions, and let me just stop my slides.
Thank you so much, Usaid, for a really powerful presentation. I think for the empirical evidence that you bring to this conversation by demonstrating the impact of the work that you've been doing on trying to support Palestinian healthcare workers in those really, really awful conditions, something that, as you pointed out, would never happen in almost anywhere else in the world. So glad that you amplified and highlighted that. I want to turn to some of the questions that have been posted in the Q&A and offer an opportunity for more questions to be posted. I'm going to try and summarize 2 or 3 so that we try and get through as many of them as possible. But one of the questions asks, other than supportive statements of solidarity, is there anything more that doctors' unions can do to put pressure on their governments? I am thinking direct action at this point, says the person who poses the question, might be the most effective mechanism. And there are other related questions about the failures and the inaction of the American Medical Association. So thinking about how healthcare workers, how doctors can do more than simply sign solidarity statements, what can they potentially do to take on their respective governments, whether it's here in the US or across the world, as well as medical associations such as the American Medical Association? What kind of advocacy efforts do you think healthcare workers could take to advance the rights of Palestinians?
So I'll give you an example. I'm part of the surgical community. So I'm sure like a lot of our audience are like medical and like they're part of societies. So if you're part of a society, you absolutely have to pressure them. When you go to one of their meetings, they brag about like the DEIs and like global health and like how can we advocate for our own people, and like a lot of them, they have PACs or like political advocacy sort of like groups, and we should pressure them. We should talk about it. We should speak up. I've been to like recently to a meeting where they kind of literally the meeting was about like global health and how can we do like global health and all of that. And for people like who are involved in global health and especially global surgery too, there are like pillars of global health. There is clinical work, you go there on a mission. There is research, there is teaching, and the big part is advocacy. And so part of us being global health kind of experts or people who are just want to do it, advocacy is an important part. And when we do advocacy, in my opinion, we have to basically be consistent. You can just advocate to like Ukraine and Russia and what's going on there, and or like other areas, like for example, you go and do like a surgical mission in one of the African countries, and then you just say that, and then when people ask you about like what's going on in Palestine, what's going on in Lebanon, you just stay silent. So this is hypocrisy. And if we as medical people are still practicing that, just I don't know how the future of medicine is going to be over the next few years. So in my opinion, we should change ourselves. We should read more about what's going on and then pressure the people in those medical societies, whether it's the AMA, whether it's the American College of Surgeons, cardiology, whatever specialty you're in, we should pressure them. We should stand up in those meetings. We should just raise our concerns. If there is like a discussion about this topic, we should say, why are we not talking about this? Why are we just so silent about this? And this way change will happen. And I'll tell you, I did that. And this is not to brag about myself or anything, but just to give you an example. I did that in a recent meeting, and I spoke up, I stood up, and I said, why are we silent about this while we're talking about like how to be like do this and that and do research and like how to kind of go to those like austere environments and stuff? Why are we silent? Why are we not talking about it? We are in an active genocide. We're not talking about it. And then like so many people after this session went and talked to me and other people. And yes, I agree with you. And I think we should do this and that. So if we do it in every meeting, in every session, in every society, this is not like we're being like violent, disruptive. This is the least thing we can do. We should stand up, speak up, and pressure those people who are in those positions to do their job. This is their job. We pay for like membership for those meetings, and they have the duty to represent us and to talk about global issues like that.
No, certainly, Usaid, and I appreciate and applaud your courage. I recognize, of course, there are always consequences for speaking up in these platforms and forum, and people are probably very worried about their career trajectories, their ability to move up the ranks, and the repression that they're facing within their respective spaces, but recognize the value and importance of what you're saying, of speaking out in whatever capacity you can, in whatever spaces you find yourself in. I want to turn to Malaina, perhaps to build on this particular question around what we can do to advocate and push for Palestinian liberation, for pushing for these cases to be investigated. And there's a question in the chat about the possibilities for pursuing violations under international law. Malaina, I'm wondering how Human Rights Watch is thinking about these particular cases, perhaps as part of the broader collection of cases you've been focusing on in Israel and Palestine. I know in the specific report, you place particular pressure on the allies of Israel, countries that are either funding, supporting Israel militarily or financially, to hold them accountable for war crimes that are being committed. I'm curious what other advocacy efforts Human Rights Watch is engaging in that could potentially speak to what Usaid is saying, sort of speaking up against what the Israeli aggression across Palestine.
Thank you, Qayyum. And really, I think what Usaid mentioned is exactly hits the spot on what people can do. It's do what you can with whatever you can. That's the maybe overall conclusion. But before I go into what HRW or Human Rights Watch advocates for, or how do we include these reportings and cases in our calls for action, I just say that as a Palestinian, let me say this clearly, statements of solidarity and actually standing up in protest, for example, or encampments on colleges do matter, and they matter a lot. For Palestinians, we always feel like are we living on a different planet? Are people not seeing what we're seeing on a day-to-day basis? Are people not seeing the live mass atrocities on their phones, on YouTube, on TikTok, on wherever? It's almost everywhere. So when we do see people standing up and we do see people loud and clear calling for freedom for Palestinians, it matters a lot to us. It really touches deep inside every Palestinian. But again, now back to HRW, these statements we know won't be enough to put pressure on governments. They won't be enough to create the action that is desperately needed to end the hostilities and end the violations of international humanitarian law and human rights law and all that. But what I would give, for example, as suggestions or what the medical community in the US specifically can do. For example, medical evacuations. There are thousands of Palestinians in Gaza waiting to be medically evacuated, either waiting for Israeli authorities to approve their medical evacuation or wait for countries to say we have capacity to take on this number of Palestinian medical evacuees. And with this, I would mention HEAL Palestine, HEAL Palestine, who have been able to bring in Palestinian children for medical treatment inside the US. And we should be seeing more of this. If countries and states are seriously concerned or genuinely worried about the Palestinians in Gaza, they should be doing more. And more is not only sending humanitarian aid to Gaza, but the health infrastructure is collapsing. Hospitals have collapsed, if not are in the virtue of collapsing. And there's no proper medical treatment inside Gaza. There are cancer patients waiting in line to seek cancer treatment outside of Gaza. So I think putting pressure means not only, the general calls that are important, like ending and suspending military transfer and military assistance to Israel, knowing the serious risk of complicity in international grave human rights, abuses and crimes, but also putting pressure on the governments to evacuate more Palestinians. I mean, if we have a collective of doctors or healthcare workers in the US that can say we have the capacity to take on 20, 10, 50 medical evacuees, why doesn't the US government do that? What is holding it back from actually evacuating some patients and treating them properly? So that's one thing, but this does not, by no means say that the unlawful attacks on hospitals in Gaza shouldn't stop, or that the humanitarian aid shouldn't be flowing in the Gaza Strip. Not 20 trucks, not 30 trucks, not the US parameter that gave to Israel a few weeks ago, I think, was the deadline for the US deadline for increasing more trucks entering Gaza. Like, there should be a flow. We should not be satisfied with 30 or 50. Before October 7th, 500 trucks, including fuel, were coming in daily in the Gaza Strip, daily. And this was when the situation of the health facilities and the health infrastructure was relatively better than what it is now. So again, it's the putting pressure type that's loud, that makes a difference and gives suggestions, not only, the big calls of arms suspension or ending ties when there's, no credibility that Israel will respect international law. But I'll say for Human Rights Watch also, it's very important that we support international justice mechanisms. So the International Criminal Court, the International Court of Justice. And at this phase, I know the ICC prosecutor requested arrest warrants that have yet to be approved by the chambers. So this might be a bit of a slap on the face. But we do have mechanisms that are already investigating and actively looking into holding perpetrators to account. So, for example, when we hear the United States and Congress people saying we will sanction the ICC prosecutor and we will sanction everyone who works with the ICC, this is when our US foot needs to be put down, where we need to support the ICC, we need to support the ICJ and respect the binding orders that they issue. South Africa filed a case under the Genocide Convention against Israel, and the ICJ has already issued 3 times provisional measures against Israel to respect the rights of Palestinians under the Genocide Convention, to bring in aid flowing in the Strip, and to coordinate relations with the United Nations humanitarian aid agencies that are working on the ground, like UNRWA. And up until today, the US has not continued its financial support to UNRWA, its donations to UNRWA. And this is just bizarre, you know. When we see UNRWA as the backbone of humanitarian aid in the Gaza Strip, and then we see the US cutting its fund or suspending its fund for the year to come or more years to come, this is a catastrophe. This is like pouring fuel to fire. It's adding to the suffering. It's adding to the mass atrocity and catastrophic situation in Gaza. So maybe the US is not ready yet to suspend arms, but that doesn't mean they don't have the capability to put more pressure on Israel to protect hospitals, to protect healthcare workers, not to detain individuals who are literally at the forefront of assisting Palestinians to survive in the Gaza Strip. So it's about being loud and clear, suspend military arms transfer, use whatever leverage is possible. And we know for a fact that the US has so much leverage on Israel, but we're not seeing it in action. And this is where maybe the general US community needs to step up on putting pressure on their elected officials. But other than that, as healthcare workers, really, it's showing how, for example, when we talk about medical neglect inside detention, who do you think is imposing this medical neglect, or who are responsible in a way? It's the Israeli authorities at the bottom line, but it's the doctors who are in, for example, Sdei Timan, the healthcare workers who are in the Israeli prison facilities and detention facilities who turn their face. And where's the ethical responsibility of a healthcare worker? You know, the first thing, I'm not a doctor, but the first thing is giving oath that you will provide, I don't know what the oath exactly is, but it's prioritizing your ethics as a medical personnel over anything else. But in Israeli prison detention facilities and all of that, we're seeing doctors in a way bowing down to political interference, to how much they can support or give treatment to detainees. And I'm not saying this off of the top of my head. Clearly, one healthcare worker we spoke to was seeing what the paramedic that was changing his gauze on his injury, like they were doing the bare minimum of medical treatment, and this is just in violation of international humanitarian law that says it should be adequate treatment. It should be constant monitoring. And that's not what we're seeing. And that's mainly the interference. But what I wanted to say is the healthcare workers the healthcare worker we spoke to said and testified that the paramedic in the Israeli prison service said that this is the only thing I can give you. I can't give you more or I'll get in trouble. So this just shows a hint of complicity of medical staff in the implementation of, unfortunately, torture and ill treatment of detainees.
Totally. You've actually answered a couple of questions that were posed in the chat around the complicity of the Israeli authorities, including Israeli healthcare workers, in what's unfolding in Israeli prisons. I see Usaid has his hand raised, but I want to quickly pick up on 2 related questions and comments that are made. And then perhaps hand over to you, Usaid, also recognizing we've got 6 minutes left. There's a really powerful comment which says, I'm just going to read it directly. It says, "Thank you, Dr. Alser, for speaking with clarity in increasingly hostile medical spaces. I think we need to reckon with the fact that racism and anti-Muslimness and anti-Palestinianism also drive the inaction and silence in the face of complicity. And I'm thinking about that comment in relation to another question that's being posed around the medical establishment, the academic establishment, and the process of publishing your work. You mentioned, Usaid, that it took about 8 months to get your piece published in the Lancet. And the question is, after going through the process of publishing your work, do you feel that academic publishing is a worthwhile strategy for us to fight against the genocide, especially considering lengthy, unyielding review processes and the fact that the terminology largely has to be watered down for journals even to consider? So perhaps you could respond to that as well as one of the other points you wanted to raise, Usaid.
Yeah, I mean, absolutely. I mean, medical journals, they're like the medical societies. We have to make them do their job. They brag about diversity, equity, and and all of that. And they brag about like advocacy, and they publish a lot of pieces about this country and that. There should be a consistency in the way they publish things, especially those big journals, who are basically, for those who are in the research field, they basically live on like peer reviews, like who are providing peer review for free, and they're living on them, and then like they charge you for anywhere from $3,000 to like $6,000. And we're talking about those like big journals, like top 10 journals. All of them are like that, with very, very few exceptions. So they're basically, yes, they're advancing the science and all of that, but there are complicit in many, many ethical issues, including not speaking up about what's going on here. And we're not asking the editors to write pieces. We're asking them to just allow people to express their opinions and not censor us. I mean, myself, I can share personal experience. I mean, I'll give you an example. And you guys are like talking from the Harvard kind of like FXB. And next door to you guys is the New England Journal of Medicine. New England Journal of Medicine, not just me, a lot of people have submitted pieces, opinion pieces about Gaza, about like West Bank, about like a lot of issues. And they got this rejection. Myself, I submitted a paper. Not that I'm like a researcher that is in the level of publishing in New England Journal of Medicine, but an opinion piece that is very, very similar, not like, copy paste, but very similar tone to a piece that was written about Syria and another piece that was written about Ukraine. And we intentionally try to use a similar tone so that we see if the New England Journal of Medicine is going to publish that. And it literally, same day, this rejection. And they did not provide a reason, but it's very obvious because they just don't want to talk about it. And so there are other journals who are complicit. And yes, I want to name it because New England Journal of Medicine has to do their job. It is considered the top journal in the world in the medical field. It has to do its job. And so we have to pressure them. It is worthwhile. Everybody, in my opinion, if you are interested, even if you're not really interested in research, just opinion piece in those journals, for the most part, is going to be free of charge. But just write it. Just express your opinion. Obviously, be careful with the language, and I'm happy to talk about it. But like, we should normalize the word like genocide in medical journals. And I myself, like a lot of like the papers that I wrote, they didn't want to mention the word genocide, and got a lot of pushback. We were able to write about and mention clearly genocide in 2 papers successfully, but the rest were not able to. But it's fine. If we put pressure, we're going to get there. The Lancet, I want to talk more about my experience, was more fair, I want to say, but we pressured them. We pressured the editor-in-chief to accept what we wanted, because what we wanted to write is our opinion. There's nothing wrong in it. There is huge evidence about it. And we were able to push certain terminology in there. We were able to avoid certain things that they wanted us to put in, but that's not our words. Don't put words in our mouth. That's literally what we told the people in the Lancet. I want to give them credit for being vocal about it and publishing things, although I disagree with certain pieces they publish, but still they've been instrumental in publishing things about Palestine. I want to add just one quick point. I know we're running out of time. 2 suggestions, practical suggestion. If you are in a leadership in your program or hospital, host a ground round about what's going on. just say like host people who've been to Gaza just to talk about their experience. Everybody in like those big hospitals, they host people who been to like Africa or been to Ukraine or been to these countries, because we're talking about global surgery, global health, because it's kind of fancy these days to talk about it. Why not talk about Gaza? Bring those people, same people who wrote the New York Times article where they described the horrific scenes and the injuries they saw, especially in kids. Host them, let them speak about what they saw. This is not political. This is same thing. This is same as global health, global surgery. We should talk about it. The other suggestion is to sponsor medical students. There is hundreds of medical students who are displaced outside Gaza who are looking for opportunities to do electives, to do like shadowing, so that their medical school can consider those kind of months as part of their medical school, so that they can graduate. And a lot of people, and I want to give a shout out to those people who were able to sponsor medical students that I know very well. And they're right now in the US. There's two of them right now who are doing like hands-on rotation so that they can finish their medical school and become doctors. So this is two practical suggestions that I, from my experience, works well. And those are like solidarity in action, in my opinion.
Thank you for that, Osei. Really excellent point to end on. Milena, I know I want to give you the final word, perhaps to respond to one or two of the comments you've noted in the chat, and then we'll conclude. I see that folks are dropping off the call slowly, so please be as brief as possible. Thank you.
Yeah, thank you. Sorry, and sorry for this to be the final word. I hope Said was the final word, but I just wanted to flag a November 2023 research from Human Rights Watch where we investigated Israeli attacks on 4 hospitals: Al Ahli Hospital, the International Eye Care Center Hospital, the Turkish Palestinian one, and Al Quds Hospital. Attacks between October and November 2023. And we know that Israeli authorities on the Israeli military on October 27th claimed that Hamas uses hospitals as terror infrastructure, publishing footage alleging that Hamas was operating from Gaza's largest hospital, Shifa Hospital. Israel also alleged that Hamas was using the Indonesian hospital to hide an undercover command and control center. Let me be clear. For these specific investigations, these claims are contested. Human Rights Watch has not been able to corroborate them, nor seen any information that would justify attacks on hospitals in Gaza. And what we mean by this is international humanitarian law gives a specific protection to hospitals and medical facilities as civilian objects, where they only use their protection when the act of like the act is being committed to harm the enemy from inside the hospital. And it can only lose protection when there is the required warnings that take place and happen. But unfortunately, the Israeli authorities or the Israeli military, when they unlawfully attack hospitals, they do not issue proper warnings. When we talk about warnings to hospitals, we're saying patients, hundreds of patients, healthcare workers who have to abide by an order of evacuation within hours. Can you imagine a patient who's on a bed trying to treat himself better, having to evacuate the hospital within hours? We've spoken to a child when we went to Al Arish in Egypt. We spoke to a child who told us he was left alone when his parents were evacuating the hospital. He left alone, thinking that patients and healthcare workers will not be forced to evacuate, and he had to leave the hospital on his own with his IV fluid and walking all the way alone. So these allegations or attacks that come in hand should still abide by international humanitarian law when we're talking about effective warning and proper implementation of humanitarian law. So just wanted to get this.
Thank you. No, really appreciate you clarifying that point on international humanitarian law and its application, particularly to attacks on hospitals and healthcare workers. I wanted to quickly thank everyone so much for their participation. Milena Said, who now has to run to be on call in his hospital. Really appreciate the depth and the breadth of this conversation, the excellent questions that have been posed in the chat. I also want to thank our hosts, the FXB Center for Health and Human Rights, the director, Mary Bassett, for facilitating and allowing this conversation to take place, and our colleagues from the Palestine program who have also joined the call. Thank you all so much. We look forward to ongoing conversations and discussions around these issues. Take good care. Bye-bye.